Hey there. Ready for a deep dive into something pretty wild?
Let's do it.
We're taking on papilledema today. And
Oh, I like this one.
yeah, it's more interesting than it sounds, I think, right?
Hmm.
You sent us some fascinating stuff on this one, and we're excited to dig in.
Yeah.
This is way more than just like an eye problem.
Yeah.
It's really about what those eye symptoms might be telling us about what's going on in the brain,
Exactly.
which is
Exactly.
where the whole deep dive thing comes in, right?
I like it. I'm into it.
So one of the sources mentions something called pulsatile tinnitus. Have you ever heard of this?
Yeah. So pulsatile tinnitus is,
I mean, it sounds kind of freaky when you say it out loud.
yeah, it's definitely a weird one. Basically, you can hear your own heartbeat in your ear. Yeah. And a lot of times it can be caused by, pressure changes in the brain, which is where papilledema comes in.
Okay, so that brings us to like the heart of the matter. This might sound like a really isolated, unusual symptom, but it can actually be a huge red flag, right?
Absolutely.
Papilledema is often a sign of something called elevated intracranial pressure,
Yeah.
or ICP,
ICP.
and that is a serious condition that needs immediate attention.
Very serious.
So let's break this down a little. What exactly is ICP and why is it such a big deal?
So think of your skull kind of like a container, right? And inside that container, you've got your brain, obviously blood and some spinal fluid, all just hanging out, doing their thing. But when the pressure inside that container gets too high, that's when you get elevated ICP. And the brain, as you can imagine, is very sensitive to these pressure changes.
Yeah, that makes sense. Like if you keep stuffing things into a suitcase, eventually it's not going to close, right?
Exactly. Exactly. There's only so much room in there.
So true. And if we think about those symptoms, it makes sense that if there's all this pressure building up inside your skull, you're going to experience some noticeable changes.
Mm.
One of the sources you sent talked about all these different signs and symptoms, and some of them were pretty surprising. Like, did you know that changes in your vision could be a sign?
Oh, absolutely.
Really?
Yeah.
Things like blurry or double vision, seeing flashes of light, or even like brief periods where your vision just goes completely dark.
Mm-hmm.
Those can all be signs of papilledema.
Yeah, and what's tricky is those vision changes, they can be really subtle.
Oh, I bet.
Yeah, they might only last for a few seconds, so it'd be easy to just brush them off as eye strain or something, especially if you're not having any other symptoms.
Right, right. It's like, oh, I just need to look away from my computer for a minute or something like that.
Exactly.
So that's why it's so important to like understand the full range of symptoms, not just focus on those vision changes alone, right?
Yeah, for sure.
And the sources you provided, they mention headaches as like a really big red flag,
Mm.
especially headaches that are worse in the morning or when
Yeah.
you're lying down.
Right. And that makes sense if you think about it. When you're lying down, the pressure in your head naturally increases just because like the way fluids shift in your skull.
Oh, wow.
So if you're already dealing with elevated ICP, those headaches can become way more intense when you're lying down.
Yeah. And it's not just headaches. One source mentioned this, I don't know, kind of scary sounding, but important thing called Cushing's triad.
Yeah. So Cushing's triad is kind of like the body's alarm bells going off.
Okay.
It's this combination of a slowing heart rate, irregular breathing, and then a widening pulse pressure. That means like a bigger difference between your upper and lower blood pressure numbers. It's like your body is pulling every lever it can to try to regulate the pressure in your brain.
Oh, wow.
And that's when, if you've got that going on, especially with a bad headache, you need to get medical help immediately, like right away.
So it sounds like we're talking about like a ticking time bomb here.
Hmm.
What actually causes this pressure to build up in the first place? Like the brain's not actually like inflating like a balloon, right?
No, it's not that the brain's physically getting bigger. It's more like something is taking up extra space inside the skull or messing with the normal flow of that cerebrospinal fluid.
Oh, okay.
So, kind of like that suitcase analogy. If you keep adding stuff, it won't close properly. Same with our skulls.
Gotcha. Makes sense. And the sources you send over listed a bunch of potential culprits for this. We're talking brain tumors, abscesses, head trauma, even aneurysms.
Right. Basically anything that can physically press on the brain.
And you even highlighted some less common causes, like craniosynostosis. That's what, a birth defect?
Yeah, it affects how a baby's skull fuses together.
Wow. And then there's cerebral venous thrombosis that's basically a blood clot in the brain, right?
Exactly.
It's kind of wild how many different things can mess with that delicate pressure balance inside our skulls.
Yeah. It's actually kind of incredible, and it's that variety that makes diagnosing papilledema so tricky sometimes. It's like solving a medical mystery.
It's true. You've got to look at the symptoms, the person's medical history, even their lifestyle sometimes, to figure out what's really going on.
Exactly.
And sometimes the most interesting cases are the ones where there's no, like, obvious cause.
Right.
One of the sources mentioned this thing called idiopathic intracranial hypertension,
Yeah.
or
Yeah.
IIH. And it's basically like the medical equivalent of a shrug emoji.
It is.
Doctors diagnose it when they've ruled out everything else.
Exactly. It's a diagnosis of exclusion, which is, it can be really tough to treat because you're trying to manage the symptoms, prevent complications, but you don't even know what's causing the pressure in the first place.
Right.
Yeah.
So it's like extra tricky.
It is. It is. And what makes it even more interesting is that it seems to disproportionately affect, obese women of childbearing age. Yeah. The source actually mentioned this statistic. It said that women in that group are something like 20 times more likely to develop IIH than the general population.
Wow, that's huge. That statistic really jumps out, when you read it.
Yeah.
Do they have any idea why that is?
Well, they think that hormones might be playing a role, particularly estrogen. Estrogen is known to affect, like, fluid regulation in the body.
Right.
And so it's possible that could be linked to, this increase in intracranial pressure in some women.
Okay.
But it's not the whole story, of course.
Yeah.
The source was also really clear that obesity in general is a risk factor
Okay.
for both IIH and then, like, papilledema more broadly.
That makes sense if you think about, like we were saying, the pressure dynamics inside the skull.
Right.
It's like if you're carrying extra weight, especially like abdominal fat, that can actually increase pressure in the veins that carry blood from the brain.
Exactly.
Yeah, it's all connected.
So it's like this whole fascinating link between obesity, hormones, intracranial pressure.
Yeah.
Clearly, more research needs to be done there to really understand what's going on. Absolutely.
But let's say someone is listening to this and they're thinking, like, okay, this is hitting a little too close to home.
Yeah.
What should I do if I think I might have some of these symptoms? What's the first step?
I think the most important thing is just don't wait. If you're having any of these symptoms, go talk to your doctor. Don't wait for it to get worse. Early detection is key with this.
100%. And I know it can be kind of intimidating to bring stuff like this up to your doctor, but knowledge is power.
Absolutely.
The more you understand about, your own body and the potential warning signs, the better equipped you are to advocate for your own health.
100%.
And that's what we're doing here.
Right, there you go.
We're giving you the information you need to have those conversations.
Exactly.
So let's say someone goes to the doctor and papilledema IS suspected. What happens next? Like, what does that diagnostic process actually look like?
So it usually starts with, like, a thorough medical history, a physical exam, that kind of thing. The doctor's going to want to know about any symptoms you're having, obviously, your medical history, any medications you're on, even, things like your lifestyle habits, especially like if you've had any recent weight gain, all of that stuff.
It's like putting together a puzzle. Right?
Exactly. The more pieces of the puzzle the doctor has, the better they can see the whole picture.
Exactly. And then after that initial assessment, they'll probably want to take a closer look at your eyes. And I don't just mean like checking your vision with the eye chart.
Right. We're talking about actually looking at the optic nerve itself, seeing if there's any swelling.
Gotcha. And that requires, like, special instruments.
Right. Exactly.
Right.
Yeah, they'll look at how your pupils react to light. They'll examine your eye movements, all that kind of stuff.
Right.
Yeah, it's amazing what they can see.
It really is.
Yeah.
Like how much information they can get just by looking at your eyes.
I know, it's amazing.
So what if that initial exam raises some red flags? What happens then?
That's when the real detective work begins. They're probably going to order some imaging scans.
Okay.
To get a clearer picture of what's going on inside your skull.
Makes sense.
The most common ones are CT scans and MRI scans.
Right.
So CT scans use X-rays to create those detailed images. It's kind of like taking a snapshot of the brain's structure.
Okay.
And then MRI uses like powerful magnets and radio waves to create those pictures. And these scans can reveal things like tumors, areas of bleeding, fluid buildup.
Gotcha.
Anything that could be putting pressure on the brain.
And in some cases, they might do a special kind of MRI, right?
Yes. They might do something called magnetic resonance phonography, or MRV.
MRV, okay.
Yeah, that one focuses specifically on the veins in the brain.
Right, and that's really useful for ruling out cerebral venous thrombosis, right?
Yeah, exactly.
We were talking about that earlier where there's a blood clot in one of the veins of the brain.
Yes.
It's amazing how advanced, like, medical imaging has become.
Oh, I know. It's incredible.
You can practically see inside the brain without even, like, doing any surgery.
I know. It's amazing.
But it's not always the whole story, is it?
Right.
Sometimes doctors have to take it a step further and actually, like, measure the pressure inside the skull, right?
Yeah, that's when they might do a lumbar puncture,
Oh, okay.
which some people might know as a spinal tap.
Right, right.
So that's where they actually insert a needle into the spinal canal and take a sample of the cerebrospinal fluid.
Right, the fluid that basically cushions the brain and spinal cord.
Exactly.
And I imagine that's not the most comfortable procedure.
It can be a little uncomfortable. It's not, the most fun thing in the world,
Right.
but it is safe and generally well tolerated. And the information they get from it is really, really valuable.
It's true. It's true.
Yeah.
Because you're getting a direct measurement of the pressure inside your head, right?
Exactly.
And that can be really crucial for diagnosing and figuring out how to manage the papilledema.
Exactly. Wow.
And plus, they can actually take that fluid sample and analyze it
Mm-mm.
and rule out other conditions like, infections, inflammation.
So it's amazing how something as seemingly simple as, like, measuring the pressure of a fluid
I know.
can tell you so much about what's happening in the brain.
It's wild.
It is wild. But, once the diagnosis is confirmed and we've kind of narrowed down the cause, what's next? How do you actually treat papilledema?
Yeah. Well, the good news is papilledema is treatable.
Okay, good.
Yeah. And the approach really depends on what's causing the pressure buildup.
Okay.
Because sometimes, you treat the underlying condition, whether it's a brain tumor, an infection, whatever it is,
Right.
and that takes care of the papilledema as well.
Right. So it's like fixing a leaky faucet.
Exactly.
You got to address the... Exactly. You don't just mop up the water.
Exactly.
You got to fix the leak. But in cases where you really need to manage that pressure directly,
Right.
there are a few different things doctors can do.
Okay.
One option is medication,
Okay.
especially if the pressure's not, like, dangerously high,
Right.
So, the source you sent mentioned a bunch of different medications. Were there any in particular?
Yeah, there was one that I thought was really interesting, topiramate.
Oh, yeah, topiramate. That's a good one.
It seems to do a lot for IIH.
It does.
I know we touched on it a little bit earlier.
It's a real multitasker, that one. It was actually, originally it was for epilepsy.
Oh, wow.
But it turns out it's also really good at reducing intracranial pressure for people with IIH.
Mm.
And what's cool is it can also help with weight loss.
Oh, wow. That's huge.
Which can be amazing for people who are, struggling with both.
Right, right. Like a two birds, one stone kind of thing.
Exactly. But of course, medication isn't always enough.
Right.
Okay.
What about when it's not? You mentioned surgery earlier.
Yeah.
When does that come into play?
So surgery is usually reserved for the more serious cases, like if medication hasn't worked,
Okay.
or if there's, like, an immediate threat to the person's health,
Right.
like, if there's a big tumor or bleeding in the brain, that kind of thing.
Right.
So in those cases, surgery might be the only way to bring that pressure down quickly and prevent more damage from happening.
And I'm guessing the type of surgery depends on what's causing the problem.
Yes,
right?
exactly.
It's not one size fits all.
No. You wouldn't treat a brain tumor the same way you would, like, hydrocephalus.
Right, exactly.
Speaking of hydrocephalus, the source mentioned this procedure called a shunt that's
Wow.
often used for that. So basically, remember how we were talking about how the cerebrospinal fluid needs a clear pathway to flow?
Right.
Well, a shunt is kind of like a detour for that fluid.
Okay.
It's this thin tube, and they implant it surgically into the brain, and it drains that excess fluid,
Okay.
and then it redirects it somewhere else in the body.
Wow.
Usually it's like the abdomen,
Okay.
and then it can be reabsorbed naturally.
So it's like creating a bypass
Exactly.
for that cerebrospinal fluid.
Yeah,
So it can keep flowing without all that pressure building up.
there you go.
That's incredible.
Yeah.
It's really amazing what they can do these days.
I know. It's really amazing what medical science is capable of.
It is. It really is. But of course, surgery is always a last resort.
Right.
And it does come with its own risks, like any medical procedure.
Absolutely.
So it's definitely a decision that has to be made very carefully
Yeah, for sure.
between the patient and their medical team.
100%. You got to weigh those risks and benefits.
Right.
And figure out the best approach for each individual person.
Exactly. But beyond medication and surgery, the source also mentioned, like, Lifestyle changes.
Yes.
That can be really helpful in managing papilledema and ICP.
Yes, absolutely.
So it seems like there's a lot that we can do ourselves to support our health in this area, right?
100%. While lifestyle changes alone, they're not going to cure papilledema. They can definitely help manage those symptoms and just, improve your overall well-being.
Right.
And honestly, one of the simplest but most effective changes you can make, and that's going to sound really basic, but it involves your bed.
Really?
Yeah. Elevating the head of your bed, even just a little bit, can actually make a huge difference.
Really? Wow. That's so simple.
Okay.
How does that even work?
So when your head's elevated, gravity just helps improve that drainage of the cerebrospinal fluid, so it's not building up so much.
Oh, wow. Okay.
Yeah. And, it might seem small, but those little changes add up,
Yeah.
especially when you combine it with other healthy habits.
Right. So we're talking like maintaining a healthy weight,
Yeah.
eating a balanced diet, regular exercise,
Yeah.
managing stress.
All of that, all those things contribute to better overall health,
Right.
which can impact your intracranial pressure, too.
It's really incredible how interconnected our bodies are.
It is.
Like how something as simple as, the way you sleep, what you eat, all of that
I know.
can really impact something as serious as this.
It's wild.
It is wild. But it also shows that we have the power to take control of our well-being.
Exactly.
And that brings us back to why we're doing this whole deep dive in the first place. It's about being informed
Yeah.
and proactive about your health.
Yeah.
Now, before we wrap up, I wanted to circle back to something you mentioned earlier, the Frisson scale. Can you tell us a bit more about that?
Yeah, so the Frisson scale, it's basically like a measuring stick for the optic disc swelling.
Okay.
And it helps doctors figure out how bad the papilledema is,
Right.
so they can then decide on the best way to treat it.
Okay.
It goes from grade 0, which is no swelling at all,
Okay.
to grade 5, which is like the most severe swelling you can have.
Gotcha. So a lower grade might mean medication and lifestyle changes.
Right.
A higher grade might mean something more serious, like surgery.
Exactly. It's all about finding the right tools for each person.
It is. And that's why it's so important to catch it early.
Oh, absolutely. 100%. The sooner, the better.
Right, because then you have a better chance of preventing those long-term problems,
Exactly.
like vision loss.
100%.
So it all comes down to, like, listening to your body,
Yes.
paying attention to those signs,
Absolutely.
and, not being afraid to talk to your doctor.
Exactly. If something feels off, go get it checked out.
Exactly. Advocate for yourself. Well, we've covered a lot of ground in this deep dive.
We did. That was a lot.
It's been a journey.
It has been a journey.
But it's been so fascinating to really explore the ins and outs of papilledema.
I agree. It's a fascinating condition.
And I think the biggest takeaway for me is that, what might seem like a problem with your eyes could actually be a sign of something much bigger going on.
Right.
It's a good reminder that our bodies are constantly talking to us.
They are.
We've just got to listen.
Oh.
To our listener who wrote in about this, thank you. We hope this deep dive has been helpful and empowering, and hopefully you feel a little more informed about what's going on. Knowledge is power, right?
I absolutely couldn't agree more.
And if you're experiencing any of these symptoms, no matter how small,
Right.
please reach out to a healthcare professional.
100%.
Yeah.
You are your own best advocate.
Yes.
Yeah.
You heard it here. And until next time, stay curious, stay informed, and most importantly, stay healthy.
Couldn't have said it better myself.